been a very exciting ASCO this year for PARP inhibitors and for breast cancer, and in particular women with BRCA1 or BRCA2 germline mutations, where we've seen really quite substantial activity of PARP inhibitors in 2 studies at this year's ASCO. The main study at this year's ASCO was OlympiAD, which was in the plenary session. This was a phase 3 study in just over 300 women with germline BRCA1 or BRCA2 mutations, randomizing patients between olaparib and physician's choice chemotherapy. And the study showed quite a substantial benefit for PARP inhibitors in this population, with the PARP inhibitor having a 7.2-month progression-free survival compared to 4 months with chemotherapy, so a 3-month improvement in progression-free survival. The study was definitely mature. We don't have overall survival data at this point. The study wasn't mature enough, but it also wasn't really large enough to look at overall survival. So I think, yes, the data is mature enough to start thinking of applying this data in clinical practice. The only unanswered question is about prior platinum use. So we know that platinum chemotherapy can be very active in these patients, and only a relatively small minority of patients in OlympiAD had prior platinum. And I think that's the one speck in the data being really clear that we'll get the same level of activity in olaparib in patients who'd had prior platinum. Having said that, in the approximately 20% of patients who had had prior platinum, it looked like olaparib in this study was similarly active. The second study was of another PARP inhibitor called talazoparib. This is again another very potent PARP inhibitor. This study was a phase 2 study. It was in 84 patients, many of whom had actually been relatively more pre-treated than the OlympiAD study. And similarly, we saw very encouraging efficacy for talazoparib in this phase 2 study. There was one very important finding, which was exploratory and hypothesis generating, looking at prior platinum use in the talazoparib study and how the platinum-free interval from when patients stopped platinum to when they progressed might have an impact in how we select PARP inhibitors for these patients. Those patients who progressed on platinum appeared not to derive much benefit from talazoparib, whereas those patients who'd had a very long platinum-free interval appeared to get really substantial benefit. Now, this data was exploratory. It was just hypothesis generating. We need further studies before we could look to try and use that information to guide use of PARP inhibitors in clinical practice. But it's showing something potentially important that we now need to go and validate in further studies. My summary, I think, would be that there's been a lot of enthusiasm about PARP inhibitors. We've been waiting for the data, and actually we now have the data that olaparib offers substantial benefit for patients with germline BRCA1 or BRCA2, and enough activity to look to translate this through to routine practice.